My name is Melvin.
Holly.
Branden.
My name is Kimberly, and I am a community health advocate, and I work with Prevention Point.
And I'm a healthcare advocate.
I was a community health outreach worker for Prevention Point.
And my area is Braddock, PA.
Homewood, East Liberty, and Wilkinsburg.
I serve the West End area, but basically I'm all over the place. I distribute Narcan to people.
My work involved the community of people that I came across during my years of drug use. Mostly it was just me offering free needles and Narcan whenever I would meet somebody.
I was brought up in the church, and I was always taught to make the world a better place, you have to do your part. Sure, I'm not Mother Teresa. I'm not the Dalai Lama. If I can help one person out, I've done good for the day. Years ago, when people were ODing and they didn't have anyone to turn to, that the spread of AIDS had gone up, the people were dying on the road. They couldn't get Narcan. Now that it's readily available and people are able to get it, it can save lives.
When they first came out with it, it wasn't everywhere. Now it's in hospitals. If you leave a jail, they give it to you. And it's always Prevention Point. All you got to do is call there.
You know, a lot of people don't know where to go. They're scared to talk to the police. I appreciated that it's available, and we're allowed to do this. It took a lot of years to get to this point.
I know a lot of parents and family members who have requested Narcan for their loved ones, which would have been a lot more difficult before Dr. Levine made an open script available at all pharmacies and really helped pave the way for distributing Narcan within the communities.
Finally, they passed a law where it's legal now. Some people still doesn't know that they could go to a pharmacist or go to a Prevention Point to get Narcan.
I didn't have Narcan on hand, and I almost lost my son's father. And thank God I was able to give him CPR until 911 got here to give him Narcan. I carried Narcan from that day on because it scared me to death when I seen that.
I've saved a few people without the Narcan. It could be any reason for a person to go overdose. And having a Narcan is a big difference.
One day I was showing someone how to use Narcan, and I asked the gentleman to keep a box on his truck. So he was on the south side one particular day. And so as he was installing the cable at the person's house, someone had OD'd. He remembered that he had a box of Narcan on his truck. It saved someone's life.
It's always good to have an in with people who are in active use because they might avoid getting help altogether if they don't have a reason to see you.
And now the fact that we had the pandemic, more and more people are indoors. A lot of people are depressed. A lot of people are using more drugs at a high rate. We want to be able to help someone so that they won't die and they won't be alone.
Just helping people. Like, that's what I wanted to do when I got clean and save lives. That's the biggest thing. Making people aware that you don't got to stay in that mix either. There is a different way.